So I want to start by telling you about a patient of mine. So I'm an infectious disease doctor. I see patients with HIV and other infections in my clinic. And this patient came to me because she'd been newly diagnosed with HIV. She was pregnant. She had been to see her OBGYN. And they did routine screening for HIV, and she was, found out she had HIV, and she was completely surprised. She had no symptoms of HIV. She'd been tested for HIV before, and it had been negative. She'd been to see doctors. No one had ever before told her that there was something she could do or a medication she could take to prevent HIV. And so she was, upset and angry and worried. That really stuck with me. And I've seen, multiple patients like this. So as you all probably know, HIV is a virus that attacks the immune system. We don't have a cure yet for HIV, but there is medication that you can take that is very effective at treating it. And so people with HIV can live a long, healthy life, but they need to take this medication every day. It impacts about 1.2 million people in the US, and more than 30,000 people every year acquire HIV. And it's predominantly spread through sex, but could also be spread through other things like injection drug use or mother-to-child transmission during pregnancy. As you saw in the video, we have something to prevent HIV. It's called PrEP. And it's incredibly effective, like 99% effective at preventing people from acquiring HIV if they're currently HIV negative, but may be at risk for getting HIV. It's safe, and we actually have since that video, we've actually have a new option for PrEP. So there's pills every day, that you have to take a pill every day to prevent HIV. That's one option, but now there's a new option called injectable PrEP, where you can get a shot every 2 months. Which prevents HIV. And there's new technologies all the time coming down the road. We're expecting pretty soon to have a once every 6 months shot as well that will be effective for preventing HIV, which is very exciting. But unfortunately, there is not equal access to PrEP in the US. We know there are a lot of people who could benefit from PrEP, but a lot of the focus has been, from doctors' perspectives and public health agencies, has really been focused on getting PrEP for men. And women have been a little bit left by the wayside. So women account for about 19% of new HIV infections in the US, but they only make up 8% of PrEP users. And this is, especially a problem in women of color. So Black women are disproportionately impacted by HIV. They only account for 13% of the US population, but they account for 50% of new HIV diagnoses. And there are very few Black women who are on PrEP. And so a big focus of my research, and and others as well in our team, has really been on finding ways to improve access to PrEP for women of color. I talked about my patient, who no one had ever told about PrEP. Ideally, we'd like doctors, every doctor to talk to every patient about HIV prevention options, to talk to them about their risk factors, talk to them about PrEP. But we know we don't live in an ideal world, and doctors are very busy. They have multiple things to talk with patients about. And so that is why there's been this focus recently on using AI, as we heard about in the last session, to potentially improve healthcare and improve the way that we can identify which patients should be on PrEP and give that information to doctors. Use electronic algorithms. So we all, use electronic algorithms and AI in our daily lives, whether you're scrolling through Instagram or on TikTok and they give you a reel or a new video based on what you've seen before, or, Amazon can suggest what you should buy, or your Google search history, somehow Google knows exactly what you want to search for. And so can we apply that technology, to electronic health records and improving access to PrEP? So in medicine, we don't necessarily look at your Google search history, but we do have a ton of information in your electronic medical records. And so, all of these are patterns in how patients access care, whether they've been tested for sexually transmitted infections. The goal really is that we can use this information and identify patterns in order to identify people who are at risk for HIV and would benefit from PrEP. People have developed some of these algorithms, but they've really been focused on men. And there have been very few that have looked at their outcomes for women. And so that's why the goal of my ITM pilot study was twofold. So one was to really try to create an algorithm to identify women who would benefit from PrEP. And then the second was to understand women's perspectives about this, because there's definitely ethical issues. There's issues around privacy, right? If you're using electronic health data to predict something like risk for getting HIV, that's definitely something we want to know what patients think about and how women feel about that before we roll that out. The first study was developing this algorithm, an electronic algorithm, to identify women who would benefit from PrEP. So to do this, we took electronic medical record data from University of Chicago and Rush for women who had been tested for HIV over a period of 8 years. And then we compared the electronic health data for people who ended up testing positive versus people who tested negative to see if there were any signals in the data to really point towards, are there things we can use to identify people who are at risk and would benefit from PrEP? And our algorithm, performed pretty well. It wasn't perfect, but we definitely were able to pick up a signal and, do better than any of the algorithms we'd made before. Some of the factors that we found to be important in the algorithm included things like pregnancy. So women who'd recently been pregnant, that was an important factor. Infection with other sexually transmitted infections like chlamydia, gonorrhea, or syphilis. Having hepatitis C, which is another virus that can impact the liver and can be spread through sex or sharing needles. And then also substance use was another major factor among a whole host of factors that we were looking at for this algorithm. So that was, encouraging to us that we could build an algorithm. Again, it's not perfect, it needs to be tweaked. I think we need more data there, but it was one of the first algorithms that's been built to identify women who would benefit from PrEP. Part of the study also is that we talked to women. So we did surveys and we collected input from over 100 women who were seen in the sexual wellness clinic at the University of Chicago or in the gynecology clinic at Rush. And we asked them, how would you feel if there was an algorithm that looked at electronic medical records to identify women who would benefit from PrEP and who might be at risk for HIV? And overall, I would say people had positive views about it. More than half said they would be comfortable with that. But a lot of them did say they had some reservations. They were concerned about privacy and would definitely want to know that it was a secure algorithm, that the data only went to their doctor and wasn't sent to health insurance agencies or things like that. People also had some concerns about discrimination. So I want to show you some of the quotations that people told us. So one person said, "I would not mind if a computer program identified me as a possible person who would benefit from PrEP, as long as my primary care physician discussed how I can benefit as well and have a more detailed explanation from my doctor." So this really stressed that they didn't just want a computer program, telling them this. They said it's fine for it to be a tool that my doctor sees, and then my doctor who knows me can then talk to me, and we can really talk about it together to see if this is something that would benefit from me. But I don't just want the computer to tell me that this is something I need, which makes a lot of sense, right? Someone else said, "I would feel more secure to know that information," and that she was referring to knowing that it was, highly secure, private, confidential, and she really wanted to have that knowledge that this algorithm, was run in the electronic health record and kept very private and confidential and wasn't going to be spread all over the health record, or no one else would have access to that information. And then another participant said, "I'm not sure, but it sounds like it could be seen as discriminatory. I think PrEP should be offered to all sexually active people who are of age." And I agree with that PrEP should be offered to all sexually active people who are of age. And so it just highlights, this real concern that maybe the algorithm we know with AI, sometimes they can be discriminatory. They can, work better or, pick up things, that are, maybe not important or, work better for certain groups or for certain classes, based on race, gender, and those sorts of things. So I think it just shows that we really need to be careful if we are going to use an algorithm like this and making sure it isn't discriminatory and making sure that our communication with patients is clear and that we're honest with them. It was also interesting, a lot of people thought that they didn't really want an algorithm to identify them as someone who should use PrEP, but it was probably good for other people. So someone said, I have people in my life that have had those concerns and they didn't know, so I think this would be fine. But I think also highlighting like how they see this as something, people felt like they would be willing to have an algorithm run because they want everybody else to get that benefit, right? And sort of this altruistic wanting to share their information so that other people who could benefit from PrEP could really know about HIV prevention options. Again, like this was sort of a preliminary pilot work. We were doing ongoing work to try to make the algorithm better and to really make sure we incorporate patients' input and voices into any tool that we're using. So I do want to highlight a few public health campaigns just to get more information about PrEP for women. One is from the city of Chicago, PrEP Now, and then CDC has one as well, She's Well, PrEP for Women, and you can go to those websites, get more information. And I just want to close just by saying, PrEP is very safe, it's very effective, it's for women, so please, tell your friends and family, talk to your doctor if you think it might be right for you. And please email me if you have any questions. Thank you.